Professor Robert Garry is a virologist at Tulane University in Louisiana, and he joins us now from New Orleans. Robert Garry, welcome. You published a paper back in March after working with other experts concluding there was basically no way this COVID-19 virus was man-made or genetically modified. How do you feel about continuing speculation from some quarters that it was?
Well, there really is no evidence for that. I mean, and quite the contrary. I mean, this is a product of nature. No scientist could have put this together in a laboratory. We don't know enough about viruses to construct something that is this lethal and that spreads as effectively in the human population.
So there's also continuing speculation from as high up as the President of the US about some sort of accident or mistake at the Wuhan Lab and the virus escaping from there. What do you make of those statements?
Well, that's extremely unlikely. I mean, of course, you can never prove a negative. You can't say it didn't come from there. There's always a small chance. But when you compare that to all the other exposures that people have to animals, to bats, out in nature, that scenario of a lab accident is just really very, very low.
Yeah. So where and when do you believe the most likely animal to human transmission happened?
Well, that's going to be difficult to determine. It could have been, within this last year. It could have been several years. It could have been even longer than that. We don't know what animal this virus came from exactly. I mean, could have been a bat, could have been some other animal species. It would be really nice to have that proximal ancestor, the one that's closest to this SARS-CoV-2. Then we could have that piece of data and probably figure out how to stop it from happening the next time.
So if that first animal to human transmission happened several years ago, it could have happened well away from Wuhan?
It's possible. Of course, we know the first cases showed up in Wuhan, and we know that there are bat species that are in China and southern part of the country and down into Southeast Asia that carry viruses that are close. I mean, not that close. We haven't found one that's, say, 99.9% similar yet. Obviously this was a spark that landed. It landed in Wuhan. Where that spark came from, at this point, all we can do is speculate.
If the transmission from animal to human did happen possibly several years ago, as you said, why wouldn't it have been the case that this came up registered by public health authorities until in November last year?
Well, I guess it's somewhat speculative, and my teammates looked at this question. I mean, it's possible that there was a small change, a mutation that gave that virus, the progenitor, just that extra spark that it needed to spread effectively in the human population, and perhaps made it a bit more pathogenic. Then those cases showed up in Wuhan, those unusual pneumonias, and the public health apparatus was able to detect the new virus.
The Australian government is pushing for an independent international investigation into the origin of COVID-19. Do you believe that would be worthwhile, and would it uncover much more than you did in your study with those 4 other experts that you published back in March?
Well, I think we need to focus on the science, because the science is going to lead us to the answers where this virus may or may not have come from. There are a lot of politics that are coming from a lot of places around the planet. I'm not sure that's all that helpful at this point. We have a pandemic in front of us that we really need to get all the science, all the public health, all the efforts moving to try to stop this virus from spreading to more and more humans.
Yeah. And as an expert in the field who has done work on this and published papers on this, how frustrated do you get that politics has come into it? Or are you used to that?
But you can probably tell I've been doing this for a while, and I try to focus on the science. I think that scientists should be allowed to interact with scientists and get the scientific answers that are needed to meet crises like this in the public health field. I'm not naive, though. I know that politics do play a role, but we need to focus on the science, the public health, and that's what's really going to get us out of this pandemic.
Okay, Robert, just some very basic questions. How often does animal to human transmission of a virus happen?
Well, it doesn't have to happen very often to have a big impact. It just depends on, how pathogenic that virus is. Has it developed the capability of spreading in humans, from human to human very well. This virus, the COVID-19 virus, obviously has that capability. But these are often rare events. I mean, you can trigger one flu pandemic by a rare recombination event that generates a new type of influenza virus. So, they're rare when they happen. When you get a virus like this that is able to spread as efficiently as this one does, then you can see the consequences. We have these pandemics.
And so why is it that only 1 in 100 years it is as devastating as this? Well, I mean, it really is more often than that. We've seen the emergence of many different viruses over the past, just several decades. I mean, 3 decades ago, we saw human immunodeficiency virus, the virus that causes AIDS, that came out of an animal, probably a monkey of some kind, and has obviously spread around the globe and caused serious death and devastation. The first SARS, that was about a little less than 20 years ago, but we've seen viruses like Zika. We've had about 40 outbreaks of Ebola. There's another virus that I work on called Lassa fever that pretty much causes a lot of deaths in West Africa every year. So these events occur around the world all the time. I mean, they get focused on when you have these big pandemics where a lot of people die, and there's a lot of concern, a lot of economic and other side effects of the virus spreading in the population. And so what's the key to ensuring the world is prepared for the next one?
We need to invest in infrastructure in places around the world where these viruses emerge. So places where humans and animals come into contact would be one good place to start. But basically, we need to increase the public health infrastructure everywhere, because what this pandemic has shown us is that we're all in this together. We're all connected. A virus that emerges anywhere on the planet has the capability of spreading around to other people. So we need to get the whole human race up to speed in terms of their public health and other capacity to respond to these types of threats.
And Professor Garry, I just wanted to ask you one more question. This Wuhan Lab has come in for a lot of criticism from some quarters. What's your knowledge of this Wuhan Lab and the standards there?
Well, I myself have never been to the Wuhan Institute of Virology, but I do know several good virologists that have been there. The scientists there have a sterling reputation. They're very productive scientists. They publish a lot of great papers, not only on coronaviruses, but other viruses. So I would say they're at the top of their field.
Yeah. Okay, Professor Robert Garry, thanks so much for talking to us from New Orleans.
My pleasure.